Welcome back, Focus Learners. I'm Harshelle, your guide through the wild, wild world of medical coding. Okay, if there's one thing we can all absolutely agree on, it's that payers, well, they love a good reason to deny a claim. And today, we're tackling a code that hands them a denial on a silver platter if you don't use it exactly right. But hey, by the end of this explainer, you're going to be an absolute master at it. Before we jump in, make sure to like, share, and subscribe to Decode Healthcare with Herschel. It really helps us keep creating these structured explainers for you. So let's get right into it. Are you or your providers making a major surgical decision today? If you are, you absolutely have to know how to get paid for that crucial evaluation. One of the biggest pain points in medical billing is seeing an E&M claim, an evaluation and management claim, just flat out denied simply because a major surgery happened right after it. Payers love to bundle these together, kind of like a bad two-for-one deal. But honestly, that initial heavy lifting cognitive work, evaluating the patient, deciding to actually operate, that deserves proper reimbursement, and that is exactly where our hero for today steps in. Meet Modifier 57. Officially, it's called Decision for Surgery. You append this powerful little two-digit code to an E&M service that directly results in the very first decision to perform a major surgery. Think of it as your direct line to the payer. It's you saying, hey, look, this wasn't just a basic checkup, and it definitely wasn't a standard pre-op visit. This was the exact encounter where we evaluated the patient, weighed all the options, and made the critical, high-stakes call to head to the OR. All right, now let's talk rules, because the criteria for dropping a 57 are pretty strict. First up, the EM service absolutely has to result in that initial decision to operate. Second, timing is literally everything here. This encounter has to happen on the day of or the day before the surgery itself. And third, and you've really got to commit this one to memory, it is reserved strictly for major surgeries. In our coding world, a major surgery means it carries a 90-day global period. If your procedure doesn't have that 90-day global package, keep Modifier 57 in the drawer. Now, just as important as knowing when to use it is knowing when you absolutely cannot use it. So do not, I repeat, do not use Modifier 57 for minor procedures. Those are the ones with a 0 or 10-day global period. If you're looking at a minor procedure, you're probably going to want Modifier 25 instead. Also, if the surgery was already planned before the patient even walks through the door today, nope, you can't use 57. And what about routine preoperative visits? Well, those are already baked into the surgical global package. Slapping a 57 on a routine pre-op isn't just a tiny oopsie. It's a guaranteed denial that's going to cost your practice real money. So how do we protect ourselves? It all comes down to your documentation. If you want to survive an audit, your clinical notes have to clearly lay out the clinical reasoning for that surgical recommendation. You need to show that a real, robust discussion of surgical options happened right there with the patient. But the holy grail here? There must be undeniable proof in the medical record that the decision to operate was made during this specific encounter. You have to prove, beyond a shadow of a doubt, that it wasn't just a routine, pre-planned visit. Let's actually bring this to life with a real-world scenario. Imagine a patient rushes into the ER in agonizing abdominal pain. The surgeon gets called in, evaluates the patient, diagnoses acute appendicitis, and decides right then and there to do an emergency appendicectomy that exact same day. Because that specific EM visit resulted in the very first decision for a major surgery, the surgeon can confidently bill their EM code, slap on Modifier 57, and rightfully secure payment for that vital cognitive work. Now let's flip the script and look at a totally different setting. Picture a super busy orthopedic clinic. A patient comes in dealing with severe chronic knee pain. The surgeon does a detailed exam, reviews the latest imaging, and right there in the office recommends a total knee replacement for the very next day. A total knee replacement is a major surgery. It's got that 90-day global period, and the decision was made the day before. Because of that perfect storm, the E&M service for that office visit correctly gets a Modifier 57. But listen up, Focus Learners, because you've got to be careful. Modifier 57 carries a medium audit risk. Honestly, it's one of the modifiers Medicare scrutinizes the most. Payers are incredibly motivated to verify that your encounter wasn't just some routine pre-op visit secretly tucked into the global package. So what's the biggest mistake coders make? Trying to use 57 on minor 0 to 10-day global procedures, or trying to use it for surgeries that were scheduled 3 weeks ago. Do that, and you're literally pulling a massive audit trigger. It's like putting a giant neon sign over your practice. All right, to really lock this in, let's put Modifier 25 and 57 head-to-head, because coders mix these two up all the time, but honestly, they serve very different masters. Look at the core purpose. Modifier 25 is for a significant, separately identifiable E&M, but Modifier 57, that is exclusively for the initial decision for surgery. The procedure type is basically your cheat code here. Modifier 25 goes with minor procedures, while 57 is strictly the domain of major surgeries. And that translates right over to the global period. If you see 0 or 10 days, you go with 25. 90 days, you are safely in Modifier 57 territory. And that wraps up our explainer on Modifier 57. Mastering this one is going to keep your claims super clean and keep that revenue flowing for those major surgeries. Coming up next in Part 8, we are taking on the absolute heavyweight champion of audits, Modifier 59, the distinct procedural service. Trust me, you do not want to miss how to navigate those massive compliance risks. But before you go, I want to leave you with this. If a payer audited your last 5 major surgery claims today, would your Modifier 57 documentation actually hold up to the scrutiny? Think about it. Until next time, keep your coding accurate and your documentation spotless.